It comes in for breast lift surgery. After the examination, we can see if the breast lift could be performed just using implants versus needing to require surgical incisions on the breast to redrape the breast tissue and lift it. There's two ways of doing it. One way is doing the circumareolar incision or the vertical incision, which are the prevalent and the ones that I tend to use. There's also the Wise pattern, which is the anchor type breast lift or mastopexy, which a lot of people know about, but we try to avoid that one because it creates more scarring. As I can show you in this diagram, the circumareola or the donut type breast mastopexy incision is placed around the areola, and then depending on how much tissue we're removing, also elliptical or round incision is performed where all this skin in between is removed. Okay. Most of the time, and this type of breast lift requires an implant, and then we just make an incision and go down to the retro pectoralis area behind the muscle and put the implant, and then this tissue is redraped or reattached to the areola, and that concludes that type of surgery. For the vertical type of breast lift, if you have a lot of sagging and we need to remove more tissue, most of the time we'll perform a vertical type incision where the incision is placed through the areola, and then another incision on the skin is done around the areola and down to the inframammary fold. Okay, and the tissues are then redraped accordingly. The excess tissue is removed and tissues are redraped. This could be done without without an implant or with an implant. Sometimes if the sagging is excessive, we would need also to reposition the tissue inside the breast parenchyma, and most of the time what I prefer to do is use a pedicle where the blood supply would be coming to the nipoareolar complex, and then the excess tissue inside the breast is removed laterally and in the bottom of the breast tissue. On the rest of the columns, these are brought together to the midline, and it creates that cone of breast that we're going to use to reshape the breast. And then the skin is just redraped over that cone of breast tissue.